Hello viewers and welcome to the Carbone Lawyers podcast series, better known as the Law Lab. My name's Tony Carbone. I'm the managing partner of Carbone Lawyers. We're very fortunate today to have an experienced physiotherapist, David Fahey. He runs Enhanced Physiotherapy in Melbourne and Williamstown. G'day, Dave.
G'day, how are you?
Thanks for coming on board.
No worries.
And we have a senior associate, Joseph Carbone, who predominantly does work covering TAC claims at Carbone Lawyers. G'day, Joe.
G'day, Tony. G'day, Dave.
G'day.
Viewers, today we've got a very, very important episode. David's come along to explain to us what the physios do to help you after you've had a car accident or work accident in particular. And it's very important that we got someone that's hands-on. But before that, we're going to do a story that's been in the news and it's been getting some very significant headlines, and I've had some part to play in all of this. It's the concussions surrounding footballers and people with head injuries. Joe, tell us a bit more about this.
Yeah, Tony. So it's now been established through the unfortunate deaths of Shane Tuck and a couple of other footballers such as Polly Farmer and whatnot that repeated concussion can lead to a condition abbreviated as CTE, which is damage to the brain and has led to a whole array of issues for footy players and past players involved in contact-type sports. So there's been plenty of litigation that's occurred in the US regarding this, and there's also been a class action that's been led by Peter Jess, a player agent in the AFL.
Oh, I know, yes.
Yes, and he's recently had discussions with the AFL about setting up a $2 billion compensation fund for players that have suffered this type of condition. So, yeah, that's recently occurred, and it's something that's going to be pretty interesting and big moving forward.
David, you've no doubt dealt with footballers and other people, even at the junior level and probably amateur level, that have sustained quite nasty injuries, and you've probably come across quite a few with head injuries.
Definitely.
What's your take on all of this?
Yeah, so concussion is something that there's a growing awareness around it, largely because concussion is a small brain injury that happens, and it's a bruise to the brain, and that can affect cognition, so your thinking can affect memory, balance, lots of different aspects of someone's quality of life, and that can go into what's called long concussion, can last for even 3 to 6 months if not treated properly. So there's now actually a specialty of physiotherapy that's starting to focus on concussion rehabilitation as well.
Well, my take on it from the legal point of view is that we can't avoid these sort of head knocks because of the nature of the sport, the NFL, VFL, AFL. But the thing is, where the authorities and the Stipes have got it wrong, and the commission, is the way they dealt with it back in the day. They should have reasonably foreseen that a head knock would probably need a period away from the game so that you can recover. And that's what they're doing now. I think now if you sustain a concussion, you're on the sidelines for a bit. You've seen it on TV these days. And then if they come back with a diagnosis of concussion, then you're out for the next, 12 days perhaps, Dave?
Yeah, it's a mandatory week off.
Yep.
And then also there's now a protocol that you have to pass progressively, increasing your exercise intensity. And if there's any symptoms, you go back another stage. So it's quite a rigid protocol now to recover.
Joe, because of the magnitude of the numbers of people that have been affected, realistically, at some point in time, they have to set up this fund.
Yeah, I think so. I mean, look, for the average worker out there, we have workers' compensation scheme in all of our states and territories in Australia. And look, it stands to reason. AFL is going nowhere. It's part of the culture, especially in the southern and western states. It's a contact sport. If people know what they're getting into, there's going to be side effects, unfortunately, for people who've got head knocks and whatnot. And that means that there's going to have to be a fund set up for the players that unfortunately progress with this disease.
Well, a good example, Dave, in the US, when the NFL took on the case for all those players, retired players that were really suffering, there was suicides and there was people with nasty depressions, they set up the fund that was worth a lot of money, and then when a player's affected, they can go and get paid from the fund for treatment and whatever else. In the cigarette cases, if you recall back in the States, they set up a fund again. In Australia with asbestos, they set up a fund. So anyway, look, this is going to evolve. As it evolves, we'll come back to it, viewers. David, physiotherapists.
Yes.
You guys are a very, very important part of what we as lawyers do. A lot of our clients have nasty work injuries. nasty car accidents, nasty public liability injuries. Tell us a bit about what you do. What's a day in the life of a physio?
Sure. So particularly with TAC and work cover clients, I think there's got to be a level of respect of how that injury has occurred, a little bit more than your average sports injury or, say, an office worker who has a bit of a stiff or sore neck or back. Normally these injuries have occurred through trauma, whether it be slips, trips, falls, something hitting them at work if they're, say, like a factory worker or something like that, or repeated stress or strain, not to mention the psychological trauma that comes with physical injury or the stress of losing work. So I think it's really important that if you are seeing these people clinically as a physio, you have to respect more than just the physical injury, but you have to think of the person in the context of their entire lifestyle and how this has impacted their quality of life.
And obviously people have got different pain thresholds, don't they, David?
Definitely.
Yeah.
Yep.
Joe, what are the figures, in a broad sense, of what we're talking about in terms of injuries at work?
Injuries at work are a big drain on the Australian economy. I think a few years ago, the Victorian Work Cover Authority worked out or set out to work out some figures, and apparently came to over about $50 billion loss per year in productivity, which is
there's about 60 plus thousand accidents of varying degrees of severity just in the Victorian work cover system.
And I mean, the scheme is set up to get people and rehabilitate them and get them back to work as quickly as possible, and mechanisms in place to allow people to access physiotherapy, osteotherapy, other types of treatment and whatnot if an injury occurs. Dave, I've got a question for you actually.
Yes.
Do you want to just explain to us the actual specialty of physiotherapy?
So we can go through that where, say, for example, a common injury would be a shoulder injury. That's a really common injury that you see in work cover claims.
See a lot of those.
So what we tend to get with that will either be an MRI or an X-ray or something that will give us ultrasound that will give us the structural diagnosis if there was one that's been done.
Yep.
So that will normally happen with trauma. That will give us an idea of what areas of the shoulder we'll have to rehabilitate to strengthen, to improve, but it'll also give us an idea of what function they may not ever go back to. And we were discussing that earlier, is that after some of these injuries, there's potential that there's not a return to full capacity, and that's probably where you guys kind of come in and we discuss how we can get that balance of getting them to as good as they can be, but also finding a way that they're compensated for if there's issues of not being able to achieve that pre-injury capacity.
Well, David and Joseph, what I find is this. We've got cases, for example, of people needed surgeries on rotator cuff tears, okay? Now, after you've had a surgery, it's important to start mobilising this joint.
Definitely.
And getting it moving again. In simple language so that the public can understand. You're trying to get the function of the shoulder to move again, correct?
Correct.
Tell us what that involves.
Yeah, so depending on what's happened, but largely it will involve a progressive increase in intensity and challenge of movements that are related to their life. So if someone has to work overhead, say they're painting roofs, as a really simple example, they're going to have the ability to achieve full range of motion above their head to be able to reach what they want to paint. So we're going to have to work from starting below at their waist, working their way up to above their head, also working to out by their side, and things such as you're going to have to wash your back, wash your neck, wash your hair. You need to be able to achieve above your head, behind your back, across your body, and not just working on just work, because we don't want to see people as just a worker bee. They're a person who has to live the rest of their life.
Yep.
They also might have hobbies that they can't get back to that we want to help them with.
Joe, one of the key components of David's discussion was that essentially a lot of people won't make a proper recovery. I mean, my experience, I've been doing this over 35 years. I've found that a lot of people with nasty injuries, especially shoulders, they never get a full recovery.
Yep.
What they'll do is they'll get back to a certain level of functioning, which precludes them from doing a lot of things. You've got examples of cases you've done.
No, so look, common issues that we come across are particularly in the shoulders. There's a restricted range of motion. You got tears and whatnot that occur, and sometimes we've seen it lead to a frozen shoulder type syndrome.
Yep.
Dave, in terms of frozen shoulder, what would you do for something like that?
Yeah, so frozen shoulder is a reaction of the shoulder joint, often from like a surgery or an injury where that early mobilisation hasn't occurred, and then that joint reacts and stiffens up. So that can cause what should have been a recovery of maybe 6 to 12 weeks can open up to 6 to 12 months or never. So you lose range above your head because of that reaction that happens in the joint. You get scarring and tightening of the shoulder capsule. So therefore, you then lose that ability. Again, going back to our roof painter, being able to reach the roof, they're going to have to find alternate duties and not be able to return to exactly what they were doing prior.
And Dave, you mentioned before, and this is very important.
Yep.
In a lot of instances, you've got a lot of issues with the WorkSafe people, the authority, and also TAC, in terms of being able to achieve the right balance of treatment for these injured people, correct? And more often than not, because of all the argy-bargy around who's paying for what, they don't get the treatment in a timely manner. That causes problems too, doesn't it, David?
Yeah, I think there's got to be a little bit less of the us versus them mentality that happens sometimes with therapists and the payers. I think a lot of the therapists can do a lot of work for their client by being really good with their documentation, taking assessments that are then able to be given to the authorities to prove that they need more treatment. I think where therapists get themselves in trouble is their documentation's a little bit lackluster. Then we can't go back and rely on that to ask for more therapy. So if you're looking for a therapist and you have a work cover claim or a TAC claim, you should always be ensuring that they're taking questionnaires or objective measures, because that's what they're going to use to prove to the authorities that you need more treatment or that you haven't achieved the level that you should have, therefore probably passing on information to you to execute a case where they might get some compensation.
Realistically as well, the quicker you get treatment for certain types of injuries, the better. Is that
Definitely. And there's a lot of evidence that the quicker you return to work in some capacity, the more chance you will return and the more chance you'll make a better recovery. So finding other alternatives and working with the therapist to work with their workplace, even if you are that person who lifts heavy things and carries things, if you can work in the office for 3 hours a week, you're back connected with your social structure of work, you're still in the routine of work, there's a much higher chance you're not going to slip into a depressive cycle, stagnation, not going back to work long term.
Joseph, in a lot of these cases, insurers like TAC and WorkSafe go through periods where they try and chop a lot of benefits off.
Probably from our experience, that's what we see from time to time.
It happens quite a bit.
It's never said, but there's probably a period where, there's some budgetary squeezing, let's call it, which I think is probably a little bit counterproductive sometimes.
I'll take it a bit further than that. I reckon they try it on people, because I had one lady who had a car accident. She had never seen a lawyer in 12 years. She only came to me because she said, I need treatment. And at that point I said, you've got a good case. And we got a common law settlement. Now, they just picked her out of at random. And at the time I probably had another 5. So the reality is, the viewers, it's important that you speak to people like David, speak to people like Joseph and myself, know what your rights are. It doesn't take much to work them out, because bottom line, there is a way of dealing with your problems. And you deal with them by actually being positive about it. You just don't bury your head in the sand and let it go. Isn't that right, David?
Definitely.
Joseph?
Yeah, exactly.
And you've had a lot of these where benefits have been cut off and you've managed to get them reinstated?
Yeah, there's appeal mechanisms under the work cover and TAC scheme. So, most definitely, if you've had entitlements cut, your physiotherapist or other allied treatment provider says that it's premature, most definitely you can look at appealing it.
We've essentially come to the end of the show. Dave, is there anything else you want to quickly say? Because unfortunately these episodes don't last too long.
The key lessons I think for people who are seeking assistance is to find someone who is doing an exercise active approach, making you work hard in your sessions, but also really good at their documentation, so you can take that as proof to continue your therapy. They're my key points.
Joseph, thanks for coming on board. David, really appreciate you being here today. No doubt we'll have you in the future.
Sounds good.
Viewers, thanks for watching. Go to our social media pages on Facebook, LinkedIn. Go to our website. And if you've got any questions, don't hesitate to contact Joseph, myself, or one of the other lawyers in the firm. Stay tuned for future episodes, and remember to always stay safe.